Neisseria gonorrhea or Gonococcus, gram-positive cocci Streptococcus, pneumococcus and gram-negative cocci में Gonococcus और meningococcus. ठीक है. Common features of genus Neisseria include they are gram-negative cocci, they are aerobes, they are non-sporing, non-motile, they are oxidase positive, which is an important feature of genus Neisseria. They are oxidase positive. They are diplococci. Some are commensals in the mouth and upper respiratory tract, and some are pathogens. Example of members of the genus Neisseria include Neisseria meningitidis and Neisseria gonorrhea. Various features of Gonococcus include its morphology, its culture characteristics, biochemical features, antigenic properties, resistance, pathogenicity, epidemiology, lab diagnosis, treatment and prophylaxis. Morphology में kidney shaped diplococci with adjacent sides concave. They are found in smears from urethral discharge in acute gonorrhea cases. They are found predominantly within the polymorphs, some cells containing as many as 100 cocci within the cells. Gonococci, they have pili on their surface. These pili act as a virulence factor. They help the bacteria to adhere to the surface of mucosa and promote virulence by inhibiting phagocytosis. In culture characteristics, Gonococci, they are aerobes growing at a pH range of 7.2 to 7.6, a temperature range of 35 to 36 degrees Celsius. 5 to 10% CO2 is essential for their growth. They can grow on chocolate agar, on Mueller-Hinton agar, and Thayer-Martin medium, which is a selective medium for Gonococcus. Thayer-Martin medium contains vancomycin, colistin, and nystatin. Colonies of Gonococcus are small, round, translucent, convex, or slightly umbonate with finely granular surface and lobate margins, and the colonies are soft and easily emulsifiable. 4 types of colonies of Gonococcus have been observed: T1, T2, T3 and T4. The T1 and T2 varieties are pileated and virulent, and they are auto-agglutinable, while the T3 and T4 varieties, they are non-pileated, they are avirulent, and they form a smooth suspension. Biochemical reactions of Gonococcus include Gonococcus is fermenting glucose, but it does not ferment maltose, while in case of meningococcus it ferments glucose and maltose both. So maltose का M goes with meningococcus का M, और Gonococcus में सिर्फ glucose ferment. Antigenic properties of Gonococcus include it is antigenically heterogeneous, it is capable of changing cell surface structures to avoid host defenses. They have pili which act as a virulence factor, promoting attachment to the surface of host cells and inhibiting phagocytosis. Pili undergo antigenic and phase variations. It also has a trilaminar outer membrane which has protein 1, 2 and 3. It produces an endotoxin. The outer membrane contains a lipopolysaccharide or an endotoxin which may be responsible for the toxicity in gonococcal infections. The structure of Gonococcus, it is a gram-negative coccus. Resistance of Gonococcus, it is very delicate, readily killed by heat, drying, antiseptics. It is a strict parasite which dies in 1 to 2 hours in exudates outside the body. In cultures, it dies in 3 to 4 days. It survives in slant cultures at 35 degrees Celsius if kept under sterile paraffin oil. And to preserve for long term, for many bacteria, long term preservation, lyophilization has been used. Even for Gonococcus, it can be used. Gonorrhea means flow of seed. In this condition, it is a venereal disease which is known since ancient times. It is acquired by sexual contact, and attachment or adhesion by pili is rapid and firm, so that the micturition after exposure does not provide any protection against the infection. This is the mechanism of pathogenicity of Gonococcus. It will attach to the surface of the cells, then going inside and producing enzymes and causing cell damage and producing infectious exudate and leading to lesions in the lumen, urethral, vaginal, anal and pharyngeal. In men, the disease starts as acute urethritis with mucopurulent discharge containing gonococci in large numbers. The infection spreads along the urethra to the prostate, seminal vesicles, and epididymis. Water can perineum is a condition in which gonococci can spread in the periurethral tissues, causing abscess and multiple discharging sinuses called water can perineum. In women, the initial infection involves the urethra and cervix uteri. The vaginal mucosa is not usually affected in adults because the stratified squamous epithelium is resistant to infection by the cocci, and the acid pH of vaginal secretions also protects them against gonococcal infection. So in case of adults, vagina is not involved, but the cervix is involved. Infection may extend to Bartholin's glands, endometrium, and fallopian tubes. It can lead to pelvic inflammatory disease. It can lead to salpingitis. It can lead to sterility. Another syndrome known as Fish-Hoodt-Curtis syndrome has been observed. It is rarely peritonitis may develop with perihepatic inflammation, and this is known as Fish-Hoodt-Curtis syndrome. The clinical disease is as a rule less severe in women as they are more asymptomatic carriers. The infection is more severe in case of males, and in case of males, asymptomatic carrier is rare. It can also lead to proctitis, conjunctivitis, blood invasion, metastatic lesions like arthritis, ulcerative endocarditis, and very rarely meningitis. Non-venereal infection caused by gonococcus is gonococcal ophthalmia, which occurs in newborns during passage through the birth canal. If the mother is having gonococcus in the birth canal, the child can acquire in the eyes, and it can lead to gonococcal ophthalmia in the child. Gonococcal bacteriemia also leads to skin lesions, especially hemorrhagic papules and pustules on the hands, forearm, feet, and legs, and to tenosynovitis and suppurative arthritis, usually of the knees, ankles, and wrists. Epidemiology में gonococci exclusively human disease. Source of infection is human carrier or a patient. Mode of infection is almost exclusively venereal, except one case, that is gonococcal ophthalmia, which is mother to child transmission. Asymptomatic carriage in women makes them a reservoir serving to spread infection in their male contacts. क्रेडिस मेथड करके एक मेथड होता है जिसमें इंस्टॉलेशन ऑफ 1% सिल्वर नाइट्रेट सॉल्यूशन इनटू द आईज ऑफ ऑल न्यूबॉर्न्स बेबीज is done to prevent ophthalmia neonatorum. In lab diagnosis, sample collection in acute gonorrhea and chronic gonorrhea. In acute gonorrhea, the urethral discharge contains gonococci in large numbers. The meatus is cleaned with gauze soaked in saline, and the sample of discharge is collected with a platinum loop for culture or directly on the slide for smears. In case of men, urethral discharge is taken. In case of women, urethral discharge or cervical swabs can be taken. In case of chronic gonorrhea, there may not be any discharge. The morning drop of secretion can be taken, or exudate obtained after prostatic massage can be taken. Centrifuge deposit of urine can be used as a sample. Sample transportation में Stewart transport medium is used for gonococci. If the sample cannot be inoculated immediately, it should be collected with charcoal impregnated swabs and transported in the Stewart's transport medium. In microscopy, when you see you can see pus cells, and the pus cells, several pus cells can be having a small gram-negative cocci in the cytoplasm. These plenty of gram-negative cocci, even in several hundreds in numbers, can be found in the pus cells. Intercellular location is more common than extracellular. In microscopy technique, gram stain showing intercellular gram-negative replococci and fluorescent antibody techniques, which is more sensitive and specific. In culture, Mueller-Hinton agar can be used, chocolate agar can be used. 35-36 degrees Celsius is temperature, 5 to 10% CO2. Thayer-Martin medium is a selective medium. Identification done on the basis of morphology and biochemical reactions. In serology, complement fixation test can be done in some chronic cases or from patients with metastatic lesions such as arthritis. It may not be possible to isolate gonococci in culture, and in such cases, complement fixation test can be useful. It is positive only after some weeks after infection, and may remain positive for months or years after the disease has been cured. For treatment, sulfonamides, resistance has developed, penicillins, A resistance is developed even in that case. Then the term known as PPNG is used, penicillinase producing Neisseria gonorrhea. They have spread widely, rendering penicillin treatment ineffective. Drugs used are third generation cephalosporins, doxycycline, erythromycin, and ciprofloxacin. For prophylaxis, early detection of cases, contact tracing, health education, and general precautionary measures. There is no role of vaccination in this case. There is a term known as non-gonococcal urethritis, which is chronic urethritis where gonococci cannot be demonstrated. And there are various organisms which can cause urethritis besides gonococci. And all these organisms are together classified as non-gonococcal urethritis. Causes of non-gonococcal urethritis or NGU include bacteria like Chlamydia trachomatis, Ureaplasma ureolyticum, Mycoplasma hominis, viruses like herpes virus and cytomegalovirus, other bacteria like Gardnerella vaginalis, Acinetobacter, fungi like Candida albicans, and Protozoa Trichomonas vaginalis. That completes the topic. Thank you.